My name is Dr. Wellens and I practice in Central Florida. And I'm here to tell you a little bit about the Remy laser and how I use it in my practice. A lot of my patients are elderly, which means that sometimes they don't necessarily look for surgical intervention. They're not willing to take oral medications for fungus in the nails, and so they were looking for the alternative to the oral medication, as topicals do not really work very well. And we have owned a previous laser that was not Remy. So basically there were two issues with it. One is technical support. As soon as we got the other laser like 6-7 years ago, I guess the rep who sold us a laser was not there anymore, so we never got a second piece for the laser, and also it was rather expensive. The other issue we had is the results were not as good as with the Remy laser. With Remy, we're getting definitely somewhere in the 90 percentile results and satisfaction, and we've had the laser now for a year, and I can tell you is we see patients back and they're definitely happier. And of course, the greatest selling point for us was it was about half of the price of the previous laser, so we were able to pass the savings to the patients as well. And the technical support is great, communication is great, training is excellent. I actually didn't even have to be physically present for part of the training, just because they do such a great job with support. When I originally was considering buying a laser, I have actually contacted one of my friends who is practicing about 1.5 hours away from where I am at, and she got it and she was so thrilled with it. So I purchased one Remy laser, and then we just actually got another one in January just because we were so happy. So let me talk to you about the indications of the laser. As I already mentioned, I think that probably about 50% of my practice is utilizing the laser for onychomycosis for patients who are not wanting or not willing or cannot take oral terbinafine. Of course, being a podiatrist that does quite a bit of surgery, I utilize it for my post-surgical patients, and we basically have a post-surgical protocol where we find that utilization of laser is extremely effective in reducing the pain, the swelling. Patients like it. They definitely come in if there is an issue with a post-surgical wound. We can identify it much faster, just because we see patients probably 5 or 6 times for the laser after the original surgery, and we usually space them like every second day. The third indication for the Remy laser that I really like is painful peripheral neuropathy that does not benefit from oral medications, or patient want to try new technology, and I think it's a great way of treating patients who either cannot tolerate oral medications or basically want to try an alternative method of handling peripheral neuropathy. So I am very satisfied. I think I am overly satisfied with the service more than anything else, and that's why I had no hesitation purchasing a second laser, because the support is great. If there is an issue, I mean, we get something within 2 days. Text messaging, emails, communication is phenomenal. The second great point is it's about half of the price of the previous laser I had. And interestingly enough, I had 2 different lasers. One was for post-surgical patients, one was for the onychomycosis. Now I have one. So, and it's also like 1/4 of the size of the previous laser I had. So, I would definitely recommend it, especially since, it is a cash product. So we market it to our existing patients, and I think it was a great benefit to my practice altogether. My staff loves it. It's definitely more sophisticated than anything else we've had before for half of the price. So I don't think you can go wrong with choosing this laser versus anything else on the market.